Down syndrome is a congenital lifelong condition. It is not a disease, hence it is not treatable. Although Down syndrome cannot be prevented, it can be detected before a child is born. Down syndrome is caused by an error in cell division during the development of the embryo, whereby it receives an extra copy of chromosome 21. The disorder is associated with a partial or a complete extra chromosome 21 instead of a normal pair. Trisomy 21, the most frequent kind of Down syndrome disorder, has 3 separate copies of chromosome 21, and 95% of all Down syndrome disorders occur due to it. 4% have the extra copy of chromosome 21 because of Robertsonian translocation, and 1% has mosaicism with both normal and trisomy 21 cell lines. Down syndrome is also one of the most common chromosomal disorder, which is also the frequently recognized cause of intellectual disability. The incidence of Down syndrome is estimated to be 1 in every 1,000 live births worldwide, with the total number of people with the disorder almost 7 million now. Although in Nepal there is no official figure of the number of people with Down syndrome, but given that 593.4 thousand births happen per year, and 1 in every 1,000 is born with a Down syndrome disorder, it is estimated that there are 594 children born every year in Nepal with Down syndrome. The characteristic features of a person with Down syndrome are growth failure and mental retardation, flat back of head, abnormal ears, and many loops on fingertips, among many others. With the development of technology, the use of wide variety of screening and diagnostic tests have helped parents learn what they need to about the health of their unborn child and make informed decisions for themselves and their family within the context of their own value system. These prenatal diagnoses help the parents manage pregnancy, determine the potential outcomes, plan for complications at birth, and discover conditions that may impact future pregnancies. We would be discussing 2 such methods of prenatal diagnosis which is directly related to Down syndrome. These are non-invasive and invasive diagnosis. For non-invasive diagnosis, there are screening tests which can be carried out either in first trimester or in the second trimester. This test does not give a definite yes or no whether the baby has Down syndrome or not, but if a baby shows high risk, screening tests are followed up by invasive methods. The details of the screening tests are given here. Ultrasonography is another way to diagnose Down syndrome or other chromosomal abnormality. It can be used to either check nuchal translucency or fetal nasal bone. Nuchal translucency is a collection of fluid beneath fetal skin in the region of fetal neck, which is present and seen in all fetuses in early pregnancy. In ultrasound, it is seen as a blank space beneath the fetal skin. It is measured between 11 to 14 weeks of gestation. Normally, nuchal translucency is less than 2.5 mm, and if increased to more than 2.5, it may indicate Down syndrome or other chromosomal abnormality. The second check can be done for fetal nasal bone. The view of the nasal bone should show 3 distinct lines. First and second are horizontal and parallel to each other, like the equal sign. Top line is skin and bottom is nasal bone. Third line is almost in continuity with the skin, but little higher in the tip of the nose. Sometimes nasal bone is not seen at 11 weeks, and if this happens, USG can be repeated a week later. If nasal bone is not seen but nuchal translucency and blood test predict low result, then it is not necessary to see nasal bone in every case. The second kind of diagnosis is called invasive diagnostic test. For this, chorionic villus sampling or CVS is done on first trimester, and amniocentesis is done on second trimester. However, invasive tests have small risk of complication, which may lead up to miscarriage. During CVS, a very small sample of tissue from the part of the placenta, called the chorionic villi, is taken. The cells of the chorionic villi contain this exact same genetic material as the cells of the developing baby. CVS is usually done between the 9th and the 11th week of pregnancy. The overall risk of having a miscarriage after CVS is about 1 to 2%. Amniocentesis is usually offered after 14 completed weeks of pregnancy, most commonly between 15 to 18 weeks. This is because it has been shown to be the safest at this stage of pregnancy. The overall risk of having a miscarriage after amniocentesis is about 1%. In today's world, individuals with Down syndrome attend school, work, participate in family and community activities, make decisions, and contribute to society in many ways. Early intervention for infants and children with Down syndrome can make a difference in realizing their potential abilities and improve their quality of life. Hence, it is our responsibility to make sure that each one of those 7 million people in the world get the life they deserve.